Good morning and welcome. Jim Culkeen, the Superintendent of the Southwest Vermont Supervisory Union, and I welcome you all here this morning. Why don't we, though I think everyone in this room pretty much knows each other, we'll begin with a round of introductions just for people who may be watching this at home, and then we'll begin our agenda. So I'll start over here on my right. Larry?
Larry Johnson, Shasberry.
Fran Kinney, Shasberry.
Mary Morrissey, State Representative, Bennington 2-2.
Rick Pembroke, Southwest Vermont Supervisory Union Chief Financial Officer.
Mike Lawler, Superintendent Director at the Career Development Center.
Joy Cox, Southwest Vermont Supervisory Union, Director of Human Resources.
Cindy Brownell, Pownell Elementary School.
I'm Donna Leap, Assistant Superintendent.
Wendy Pierce, I'm the Director of Special Education at SVSU.
Dave Durfee, I'm on the board at Shasberry and MAU.
Frank Barnes, I'm the Director of Educational Technology at SVSU.
Jim Lutan, Chair of the Board at the CDC.
Bill Botso, State Representative for Pownell and Woodford.
Kai Morris, State Representative-elect for Bennington 2-2.
Thank you. We're at a crucial juncture right now. The legislative session begins Wednesday, and we're in the midst of our budget planning. Actually at the point of getting close to wrapping it up and presenting to our boards. And there's a lot in flux and a lot at stake, so I think the timing of this meeting is very relevant, and I'm looking forward to the input. So we're going to go with our legislators first. So I don't know, we have three here. Is anyone who would like to begin with opening comments? Anyone's feel? Bill, you did say that you're going to need to leave. You're on a tight schedule, so if you want to go first.
Well, I think, one, Happy New Year. Thank you. I hope it is a Happy New Year for everybody. There's a lot of work to be done. I have been working in the Commerce and Economic Development area in the State House, and I expect to do that again. And it connects obviously to education and workforce development, which is the other meeting I need to go to. The main issues that will come to commerce and economic development will lie along what I would call the line is that, like, how do we best build a 21st century workforce? You know, I've heard that around here often. I've heard it from Cindy when I've gone to school board meetings, and you know, the question was asked, what's our most important work? And you, frankly, has basically said is, you know, building the future and the future capacity for the young people in our communities. So that'll be a lot of it, but I should also add that that's key to economic development, but there are other parts to economic development that we need to pay attention to. And then I would also say is that right now, probably always, but especially right now, there seems to be a lot of concern about utility issues out there, whether it's from Fairpoint, whether it's gas lines, whether it's the impact of Vermont Yankee, not the electric impact. We haven't bought electricity from them for quite a long time, but the economic impacts, whether it's the gas pipeline, there's a whole area there that we need to look carefully at. But I really think I ought to reserve most of the time here to listening to you about where you see the budgetary pressures. I think we all know that the big items that have been out there that have been in the press that are talked about are education, both the funding and the delivery. Healthcare, I think, is continuing discussion again on how that can best work, and obviously those things connect into taxes and you know, other areas that all fits together. So just a very brief overview.
Okay. Mary, would you like to make some opening comments?
Well, there's a number of issues Bill has mentioned. Obviously, in your arena, the reform for Act 6068 is on the table with how we're going to fund education going forward. So I would also like to hear your thoughts on some of the pieces being looked at. There's been a committee that the speaker has put together for the last probably month or two, or probably even longer than that, that has been working on some reform pieces, and I don't know what has filtered back down to all of you folks in regards to that, but there's a number of moving parts in regards to that. obviously would like to have an update on where the pre-K is and the grant that came in kind of late in the part, how that would play out within the budget. Healthcare, though it is, had an announcement a couple of weeks ago that it will not be going forward in the single payer. I'm not sure if we'll be calling it something different, but something will be going forward, and that we are at, as Bill alluded, we are at a critical crossroads, as you folks are with your budgets and everything else, is that we're not sure how that is going to look going forward. Still very complicated issues within that discussion, and it's having impacts across the state, even with our healthcare providers. Right now, the hospital cannot attract or hire new doctors into this area. That's a critical problem, especially when they're primary. That's not just Bennington, that's across the state, with the exception of possibly, it was Fletcher Allen, now it's the University of Vermont's Medical Center. That's a problem, because we have promised and want to get to the point of all of our citizens being insured, but if you don't have the resources and the funding to get there, how do you do this? So they may be looking to call it all payer, but it will be a form of probably a single payer. Those discussions right now are critical. We have gone through at least $100 million. I would contend it's probably more like $200 million. And as I sit here with all of you, I think of what some of those financial pieces would have meant on the ground in our communities for us. And now we have a system that still is not functioning. So that is a great concern for me. I'm not sure where I will be this year, but I will still, look at all of these issues very carefully. The energy issues there's a whole, tax policy. I think we're hearing, we just cannot tax our way out of this. It is having a real negative impact on our communities, and all of these are serious and critical and need to be looked at very closely.
And our newest representative, thank you for joining us.
Thank you. Thank you for having me. I apologize. We have the cold going around in my household right now, so it's a little late of a morning. So a few of the different things that are coming to mind when I'm thinking about the budget shortfalls that everyone's facing and the pressures that everyone's feeling to try to stretch our dollars further. So whatever that formula is going to look like, however those dollars flow in, how are we going to be able to best maximize those? And one of the things I think there's an opportunity, we have several different state designated agencies, a number of different state-funded organizations that provide services that can help fill the gaps for unfunded mandates that school systems are feeling pressure on right now. And I think there's a greater opportunity to bring visibility to collaboration and to increase the level of collaboration so that your teachers can get back to teaching and can stop doing all the extra ancillary things that are really putting pressures on the school day and impacting the school system as a whole. I think that visibility is important. There were a number of young families that I talked to when I was on the campaign trail, some of which were leaving the state. They said, I don't want my child in this school, or I'm about to start a family and I'm not feeling confidence in our school systems, even in our private schools in this region. And that's worrisome for me, that they don't have a relationship with their school, so they don't know of the positive things that we have. They don't know of the opportunities that are here, and they don't see how it's not just kind of working in an isolated silo that doesn't yield the result that they believe their children should have. As Mary mentioned with the public pre-K, I'm very encouraged by it. I'm concerned as well as far as the capacity to deliver on that. Again, it's another mandate that's sort of put on school systems that's going to create great opportunities for a number of families that need to and would like to have their children in pre-K programs, but the ability to deliver on that by having trained staff and having those that are qualified to be able to deliver that, I'm a little concerned about that, just because I know there's a shortage as a whole throughout the region for early childhood educators. So I'm definitely curious to hear what everything has to happen and how we'll be able to help support some of the needs you have down here.
Okay.
Might I ask the question, Kaya, what agencies or organizations can help these school districts, because I think a lot of them are tapped out, but I'd
Mhm.
love to hear some agencies and that might further be able to help these folks.
So there's a number of different, when we think about unfunded mandates for schools, there's things around public health issues. There could be oral health. There could be greater supports around mental health. There could be greater supports around substance abuse. There could be supports around, now we have a K through 12 requirement for physical education. There are organizations, there are agencies, there are businesses, there are entities that are ready and willing to help because they're also invested in this process. And once you kind of ask, they will step forward. So, you know, there's some I look at, you know, for example, this is not within this group, but in BVSU, looking at the Arlington school, they have one mental health provider there that's at their school system, and he's completely tapped out. So what other ways can we help to support in situations like that where you have one individual who has to supply services for the entire school and is not able to do that when we have private individuals that are doing practices, we have state health agencies through like UCS and different groups like that that can provide some supports. So that's what I mean. Thanks for the clarification.
Okay, we're gonna go to agenda item 2. Now it says, excuse me, 3. SVSU administrators' comments, but it really should also say school board members too. So it's gonna be open to anybody at this point, because I wanna be mindful of the time. And I really think the theme for today is what concerns that we can let our legislators hear about. And, you know, for me, part of it is, you know, I'm hearing of a severe budget shortfall in the state, with, I believe, the House Speaker saying that it can't be met through cuts alone, and there needs to be additional revenue sources, which sounds to me like some type of tax adjustment. I don't know what that would mean other than that, and what is that impact going to be, and how soon will we know what that impact is going to be. And the other on the top of my mind is what's happening with consolidation. Any meeting that I have been going to, I've heard other representatives say that it will be on the agenda in some way, shape, or form. And my same concern is, how early will we be involved in that discussion? So those are my comments. I'll open it up to anyone else who would like to. Fran?
To the legislators, you're out of money. So I don't want to hear, well, this one's going to fund this. They're not going to fund anything. There is no money. So what I want you guys to do, you look at programs, and it's going to be a tough thing to do. You're going to get rid of some programs, and you're going to create some of your new programs. As you say, Arlington School's only got one person. Something else has got to go by the wayside. There is no money, nothing. So I don't want to hear people come here to this meeting, say, well, we're going to do this, we're going to do that. You're not going to do any of that. Do the tough job. I don't want the school boards to say, well, the schools are going to have to cut their budgets. We've done that over the last 10, 15 years. Time to step up to the plate upstate and do your job. And I know you're new. I'm just telling you.
I'm not funding it. You guys need to work with the
That's
other
just what I'm
agencies.
saying.
No. There's area
No.
agencies that want to help. So
I understand that, but what you just said is what I'm getting at.
Right.
Don't tell us we're going to fund it. You guys are going to have, you send down mandates, the state does, okay, and then we're told to fund, they're going to go away. No more. Enough. We've had enough of that. Look at the programs upstate, because we're going to have to make tough decisions, which we have had in the past. And it's time to get it up here. There is no money.
exactly, it's been allocated to other agencies. So you have groups that can help with your truancy issues like CRJ, who gets money specifically to help support youth. You have an unfunded mandate for K through 12 physical education, and you have area gyms who have been ready and have said that they would offer and have already had relationships. So it's not having to be money that comes out of your pocket. There are groups that already have a mandate within their funding and within their mission statements to help support this work. So it's time to just bring them to the table and let them do what they're getting funded to do.
Well,
That's what I'm speaking about. I'm not
Okay.
speaking about you having to cut a check.
Okay.
That's
Oh,
what I'm
it's not
talking
about cutting a check, we're cutting programs at our schools. and
Exactly.
That concerns us.
Exactly.
And we have been doing that. And nothing seems to be happening upstate, and my point is, and I'll just give it a perfect example. We're gonna cut the veterans home over here in town. That's the dumbest thing I've ever heard of, but we're gonna do that. They've lost funding over the last, I don't know how many years, of things that used to fund them. They don't do that anymore. Where's that money gone? My point is, let's look at things, let's use common sense. And we gotta, you wanna support your veterans, we've gotta have good education. And those are the two main things right there. You talk about people leaving the state. Yeah, they are. We're down, we used to have over 653,000, 620 now, I guess. Now, every time somebody leaves, oh well, there goes the money too. So, I just, I've sat here for years, I haven't said anything. I'm saying something. I don't want to have mandates coming down from the state. Oh, by the way, and we're not going to fund it.
Right.
Well, guess what? We're going to start saying no, I hope. The schools are going to say, hey, do that. And then they can threaten us with withholding our state aid and all that stuff. But there's going to come a time we got to take a stand. And I think it's probably now. Thank you.
Thank you, Frank. Jim?
Mayor, you spoke earlier about the committee that was formed to make recommendations to the speaker as far as educational finance reform. And I believe they've come out with basically 3 recommendations. One has to do with consolidation. One has to do with an income tax, a complete realignment of the Vermont state income tax system to assist in funding. And the other one has to do with a block grant, just distributing certain amounts of money to all the different school districts. My question to the legislators is, those obviously are going to probably be discussed over the next few months or so. And you've asked for our input. How do we, as school board members and school administrators, how does the process for us to get involved and get our input into that system where that decision making is going to take place?
Well, I would say that having the preliminary basis of what they're looking at, and those are only concepts. The rubber hits the road when you folks are either testifying in committees, and I know in the past, different delegations have come up from, this area to do. It's not an easy trip for folks. You can do it by phone as well. I always think face to face and looking eyeball to eyeball, and really what the impacts of whatever they're considering is that you weigh in heavy, because as we saw last year in March, it was an unprecedented year of budgets going down across the state. As Fran alluded or said very strongly, there's not a lot of money, and people are shifting programs and cutting this that actually could be beneficial in our different areas. We've got to look at this all-inclusive, what we're doing, what the priorities are, where the money's going to go. Because as we continue to do the unfunded mandates, we overpromise to our districts, and everyone's like, great, we're gonna get it, and there's no resources, no funding. And Kaya said, with in Arlington not having the therapists or that there. Well, we don't have them here. Go to a United Counseling meeting, they don't have the therapists, whether it's for within the schools, within, the autism community. There's not the resources there to help us get to the next step, or the funding. That's a problem. Because as I said, we will continue to overpromise to everyone that we're gonna do everything for you, and it's not happening. So that's where we're finding the challenges. But to answer your question, Jim, I would make sure that you folks, as you always have been, are as engaged in that discussion as much as possible. I guess I would also say, in looking at the income tax, that was one of the key issues and problems within the healthcare, because that was one of the 2 that came out in December when it was looked at how we were going to start to fund it. It was going to be 11% what was, it was going to be, well, it started out as an 8% income tax, and within like 5 days, it went to a 9.5. So again, where are we getting these numbers and how are they jumping within a time? Because obviously they're not realistic. And the other part was the payroll tax of 11%, which I can't imagine what would do to our economy just as a whole. People have to weigh in how it is going to impact our communities going forward. And that, it will be a tough job to do, because as I've gone to the different meetings, I'm not really hearing a lot of, we may look to do this and prioritize, and maybe where different programs may overlap or something, we'll look to pull them together to make them a stronger entity, maybe finding some funding. But those are, I know you folks have tried to, over the last number of years, almost level fund what you're doing and shifting the gears to try to implement things we've mandated to you. Well, not me, but others have mandated to you. So that's a huge concern.
I would just add is that, you know, Mary pointed out, a primary door is get in touch with your legislator, ask us to make sure that whoever's gonna be chairing whatever committee knows that you would like to be on the agenda. That's just the simple logistics. The other one, of course, and this is what I don't know enough about, is you have a school board association. And you have a superintendent's association who are always going to be, you know, major voices on your behalf there. So, you know, having that connection and building that connection, and even informing us, yourselves, what you think of what they're gonna put on the table. You mentioned 3 things, there'll be more. The school board association worked all summer, you know, and I think you went to some of those meetings, that's gonna be out there. You know, and I think the point is, I think you probably also heard the speaker said, is that, you know, all ideas are welcome, and, you know, get them out there, and do that, and I think that pertains right here too as well.
Would I be able to ask one question? I know I don't, not meaning to take the floor, but the consolidation piece, and we had a, piece of legislation before us, last year, and kind of contrary to what I would want to do, because I do listen very carefully to what you say here at this table and how it'll impact our community. Consolidation has been, I think, the right word I would want to say is endorsed by the folks that sit at this table, or have been, or a form of. And last year I could not support it because we've gone through grant after grant of having these discussions that we can't necessarily come to a point where something's able to launch. We have put out, each district wants to, at this point, I'm gonna say, pretend we have local control. But a lot of it is geared out of the state, and that we're telling you what you have to do. So how do we look to consolidate without having a real plan? Because as I said, when I look at, and we have to do it, but how do you do it respectfully for all the schools involved?
Well, that's my point, that's probably what's coming at us first off.
Right.
So that is, it's very critical that you get our input
Right.
before you make a decision on just a consolidated plan, you know? And I
Well-
think that's critical, because it's different for Bennington County than it is for Rutland County, et cetera, et cetera.
Right, and I'll use an example.
Yeah.
I'm sure they're working together in the hardest they can, but our VNA hospice is now centralized in Rutland. You know, our folks are still doing their job, but there's always sometimes this disconnect of delivery as well. They're working their tails off doing a great job, but when you sometimes regionalize and regionalize maybe more to the north of the southern section gets a little bit, blindsided by what your priorities are too. So that's my also anxiety in making those decisions. Almost be careful what you wish for. It's gotta be so thoughtfully done that everyone is respected in that process, and every district or school that's involved has a place at the table.
Who else hasn't spoken? Dave?
Just a couple of specific thoughts. If you're concerned about the cost of education, if you think that we spend too much on education in this state, and I'm not suggesting that you do. I'm not sure that everyone in this room would agree with that statement, but a couple of specific things that could be done. The small schools grant. It's counterproductive. If consolidation is where we're heading, you think that's what we should be doing, I'm not sure why we're spending money on small schools counter to what we say we believe. I would get rid of that. Hold harmless provision, is that something everyone's familiar with?
Mm-hmm.
So if your district loses students and the formula for funding is based on the number of students, and the reduction is more than a certain percentage, I don't know what that percentage is. 3, okay. Let's get rid of that. Probably small impact dollar-wise, but that's where I would start.
Sean Marie?
Dave, I agree with you 110%. And the small schools grant, which I wrote to Shap about, is $7.5 million. That is not chump change. I mean, that's a lot of money that could be redirected. And then people would have to see what it is they need to do to work together to have those same kinds of things. It's a lot of money.
Anything else, Dave?
Well, no, those are the two specific suggestions. We're gonna go back and forth on, we spend too much, taxes are too high, taxes aren't high enough. Those are two things that could be done.
Anyone else? Quiet.
We had a vote on the small school grants last year, and I think we all probably supported it, but it didn't go through the Senate. I would say that about it. Probably the most difficult vote for me because I represent the Woodford School,
Right.
which is one of your better schools, and actually delivers pretty darn well in many ways. And very volatile depending on the population there in a sense. So it's not just what you do, it's how you do it and when you do it and what avenues that you offer people. Because we seem to say these things, let's take this away or let's take that away, and people are right, they do have impacts. You just really have to be mindful of how that plays out in their life and where you're making the problem worse and maybe you're making it better. But maybe the real question is to ask is what does success look like? So let's say it's a year or 2 years from now. What does success look like to this group?
Are you looking for an answer?
Success, and everybody's going to have a different definition. We ought to
Definitely.
listen to everybody's definition, and everybody ought to listen to everybody else's definition. So that's to put out there.
One question that Mary had when we started was you wanted to know where we were on the early pre-K expansion and all of that. So, and Karen, I don't know if you were here yet when she asked that question, but I will tell you that there are two things on the pre-K. There's the state pre-K expansion and then the federal grant that we may or may not be part of. And we did decide to delay the Vermont pre-K because there's just too many variables, and the regulations haven't been written yet that we don't know what impact for. So we're in our budget planning season now and coming to the end of that rather rapidly. So to sign on to that without knowing what impact that cost was going to be, we decided to delay that a year. On the federal grant part, which is Vermont received a grant, and we are a signature to it, but all the boards haven't voted approval yet that we will accept that for the same reason. It's we all hear the term the fiscal cliff. So there's a 4-year money train coming through to fund it, and at the end of that, we own it. And can we sustain that would be part of my question. I would, as an educator, never argue about the value of particularly high quality pre-K education, and it has to be that high quality to have that value. But Karen, I don't know if you want to speak anymore. I know I might be catching you off guard and unprepared, but anything on where we are that you could add to that I haven't?
Yeah, actually, I have a few things I want to bring up. As far as the pre-K services are concerned, we're gonna use this year, and just to extend on what Jim said, we're gonna use this year to continue to build capacity within our community, and engage with partners. We do find there's two ways that we can engage partners. One is that they can be fully pre-qualified on their own, and you've heard me talk about that in the past. And then there's the partners that meet some of the quality standards, but not all. And so we've been in a position to be able to still provide services to children in those partnerships by the school district providing the licensed teacher on site. And that's one of the biggest barriers that we have right now, is having facilities that are fully qualified on their own. So we continue to look at that. We continue to work with people through alternative paths of licensure to try to build that capacity. And even as one of the quality standards of just enrolling in the STARS program and having enough STARS to be able to be a partner. So we do put some of our resources there. We're really committed to building capacity, but our limitations are people need to be growing in that capacity. We've had an incredible growth spurt in our county for people in STARS, and I applaud the people that are taking the risk to apply, even if they're just getting 1 or 2 stars at this point, because it shows a commitment and it shows that they'll move forward. Now, we know that people need 4 or 5 stars to be a partner. They can have 3 stars with a plan approved by the state to show that they'll increase within 2 years. So we're working on that, and I too, as disappointed as I was that we weren't moving forward, I completely understood that we weren't ready to move forward this year for universal because of capacity. And how do you plan and be responsible to the taxpayers when we don't know what we're planning for? That just felt really irresponsible.
Well,
So-
Karen, you do a great job, and again, I was somewhat, and it was a hard vote for me during last year's session not to vote in favor of the pre-K. And it's not that I don't want you to have the program. If we are on funding and non-resource, that and as you said, we have a grant that then goes away that the town owns after that. It has been years and years of feds punk kicking it to the state and the state punk kicking it to the communities. It's all of our taxpayer dollars, but how do you use them and use them well to actually support the very programs we want? So it's not a negative
Right.
towards what you're doing and have done a great job on a shoestring, but how do you keep growing that with nothing in place to help you?
Well, and I appreciate your comment. It's, no one wants to be an irresponsible administrator with taxpayers' money. We
Absolutely.
really wanna make sure that we're doing, that we're providing, effective programs. But we also wanna make sure that we're doing it in the context of following the regulations. And right now, we don't know what the implementation, the ins and outs. We have an idea, but until we see those rules, we really need those to help us move
Absolutely.
forward. And, as far as the expansion, the federal expansion grant, we got notification that Vermont was awarded, but I don't know about you, I have not gotten any other correspondence at all
No.
from the state, and that's been one of the frustrating things this year, has been, we've been asking for information, and it's been very, very slow to come out of the governor's office. And so that too made it really hard for us to even think about what we were gonna do, and it's, and I don't know. I mean, I thought that this grant was gonna be, they were gonna start rolling out in January. Well, it's January, and we haven't yet even had the initial conversations about participation.
Well, and that's the concern, what will eventually have a real significant problem is you're rolling out your budgets. And then all of a sudden this money comes, which I guess that's gravy. But how do you, shift gears to, implement or what you're doing or something you might have cut? It's
And just, I think just for the whole group to know, are the budgets that we are preparing moving forward as we have provided in previous years. So North Bennington, I guess I should go backwards. Woodford is a town that had voted to provide public pre-K for 3 and 4-year-olds, and every other town is 4-year-olds, and none of the boards have rescinded that. So we will continue at least with those pieces. If I may, I have two other just things to put out. Autism services, you brought it up, Mary. In 2012, there was a law approved to provide through health insurance behavioral supports for children with autism or significant developmental delays. And yet, here we are in 2015, and our children who have private insurance are able to access 20 hours or more a week of BCBA or highly specialized autism services in their homes or in another natural environment, childcare, etc. And this is a bill that covers children birth through age 21. Talk about supplemental services. Our children on Medicaid still are not able to access because of snafus in that law, and it's just so discriminatory. It just, to see in our program the children who have private insurance who get this additional service, and the children with Medicaid who do not, it is just horrible to watch the differences in their developmental growth. And I've talked ad nauseum with people at the state level, and it just is, there's a snafu in our Medicaid state plan and the politics around changing the Medicaid state plan, asking for a waiver. The designated agencies are your mental health organizations. They've been given a small amount of money. Hats off to UCS for doing their forums to try to figure out what's going on. They're in the process of trying to hire a BCBA or an ABA person, which is a specialist for autism. But we also still have these providers out there who could bill Medicaid and are willing to bill Medicaid, and it's very frustrating. And I don't know if you have anything to add, Mary, about that?
Well, I've obviously been to the forums, and the piece actually passed out of my committee because, and I warned people at the time, don't get too excited until actually the rubber hits the road, because once again, resources, funding, and our Medicaid on so many levels doesn't meet, and then providers quite honestly won't take a lot of the Medicaid because it is such a low reimbursement. That is a huge problem, and continues to be a huge problem. So, you know, we can put on a piece of paper, we're doing all of this for you, but we can't even attract as far as with the services or the care providers within the autism community. The therapies and that are not even available at times because we don't have the people in place to provide.
Well, we don't have the people in place to provide based on how the law is written.
Absolutely.
We do have people in place to provide, if we could get a caveat
Right.
to that, who are very successful service providers in our area.
Right,
So,
and I know who you're referring to, and they're very good, but you're absolutely
and
right.
it just is, for the families that are most at risk, for them not to get that support in their home or for their child is just, we're breaking our own law.
Absolutely.
I mean, I just can't wrap my head around it. And the other piece,
So Karen, just say, what's the solution? Is it resources? Is
when
it
I,
taking Medicaid dollars from somewhere else and redirecting them here? Is
it's,
it more Medicaid dollars, which is that federal state partnership? I mean, what would you encourage us to go for?
looking at the Medicaid plan to see if
I'm sorry,
to look at what our state Medicaid plan is, which is not a popular thing from what I understand
so
politically.
to see if there's another place in the global commitment on Medicaid where those dollars could be redirected towards this issue?
Or they could,
And which would be,
soften the eligibility for who can be providers in a rural state.
okay,
Well, that's
right
that's
now-
also an issue with the Medicaid, with the dental health that we're speaking of, that goes across the board on many issues. So you're right, we have to have the backbone to step up to see what the global commitment, if we can enhance that in any way.
so these things run into the earlier conversation of make cuts, make cuts, make cuts. And then we also say provide, you know, these needs here.
I don't know if it's I've never thought about it, of making cuts.
No,
The
not to
people-
this program,
Right, right.
but there are these, I just wanted to say is that there's this really difficult balancing act out there that everybody's aware of between the services that are, you know, are warranted, that are good investments, that the fairness issue that you brought up, and, you know, and how the system's designed, whether it's education, whether it's healthcare, how they actually fit together here, you know, and the ability to have the dollars available, you know, to make it work.
Right.
And yes, it is like everything else. It's always changing, it's always shifting, and you have to find, you know, the best need, hopefully mindful of what's happening with all the other needs.
One of the things that my perception, and I think it's actually more than perception, I think it's reality, because I was working with Doug Racine and people in his office for weeks, months, trying to really figure this out. And people who can provide the services that are indicated in this law, and it's now an act, and I can't off the top of me, but it was a Senate bill, I think it was 233, and I don't know, it's in titles, it's in statute anyway, and I'll look it up, but it requires certification through the state, and yet all of these people who could potentially be available are nationally certified BCBA or autism specialist providers. The state doesn't recognize that licensure, so it's a tug in our own state about who can do this service. It can be a licensed psychologist, you know, someone with a state-approved license who may not have the skill, but yet you have a national certification program that people have to go through in order to become a BCBA or an autism specialist for this highly intensive behavioral skills, and our state's not recognizing the national certification. So that's where it comes with the talking, our state Medicaid plan needs to talk to the bill or the act, and then we've got to do something up from the Secretary of State's office or something to get these nationally certified people who are available to serve through Medicaid recognized.
So we're not well aligned there.
No.
Okay, that's very helpful.
That's from my humble opinion, what I've learned through all of my
That's
conversations.
very helpful, thank you.
And I have one more very unpopular thing.
I think you said two, this will be three if by my count, but go ahead.
So we all know that there's a paraeducator study, and I don't know if you talked about this at all, Wendy.
And I haven't yet.
Okay, do you want me not to?
No, go right ahead.
Okay, so we have this paraeducator study going on in the state, and my cautions to you, first of all, I always think it's a great idea to look at the resources that we have and how we're utilizing them, and to make sure we're using them for the right reasons and efficiently and effectively. So, with that said, I just need to let you know that from our early childhood point of view, we are having so many more children coming into our system at the preschool age level with very, very complex disabilities. Disabilities that we have never heard of before, that we are learning about. And the children are so complex, and they require sometimes a lot of one-to-one support, very specific program, curriculum, modifications, and accommodations, that we really need the supports of paraeducators in order to meet those children's needs, even from a health and safety point of view. So before we just start looking at, oh, well, you have 600 children and you've got 50 paraeducators or whatever, I don't even know how they're looking at it right now because I haven't been part of that process. I think we just have to always be mindful that there are situations that warrant one-on-one services for children because of their complexities and because of the needs that they have within our school systems. And I'm not at all saying that, you know, again, that we shouldn't be looking at how we're using parents, but we have to think about the people and the children that need one-on-one services and really think about before we start just, we've got too many, we've got too many.
Has the report been finalized, or?
No, it's in the beginning stages. I know here at SVSU, we've been doing a lot of the surveys online. We've had teacher surveys, director surveys, principal surveys, and they're, from my understanding, is they're still compiling that data. And then those studies will start to come out.
Bill? 8:30.
Well, thank you very much, but I think I'd like to give this
No,
a
that's
little
fine.
more time.
Yeah.
But forgive me when I owe some time to them too.
I don't know if you are gonna speak, but one thing I'd like to, we hear things about things that might be coming from the state that might impact us financially. And special ed is one thing that, you know, Rick has been bringing up about, I don't know if you're aware, but anything that's over $50,000 on a special ed cost then gets, you know, the state pays 90% of it then. And we're hearing that cap could be going up higher, maybe as high as 75,000 before the state reimbursement would come in. And that's something I would love to put on your radar, because that would be a huge impact on us if that really came to be. And you know, I don't even know why it's 50,000. I personally think it should be going the other way. It should be lower, because what type of service some student gets who has very specific special needs shouldn't be determined by what border they are and who pays for that. When at one point historically those services were provided by the state in institutions that, you know, were state run, and that was something that's been, as you say, kicked down into the communities, and we're dealing with it. So I'll let that be your introduction.
And I think there are a number of things that are really concerning to me in the programming that we're trying to provide right now. We are working with UCS on the autism programming. The autism students in our district, the ones I'm speaking of in like a specific program, do need these specific, you know, care levels that are above and beyond what you can have with just like a normal teacher and maybe a normal paraeducator situation. The concern that Mr. Colkeen brought up with the possibility of the raise of the 50,000 limit is concerning. I have some concerns about, again, what Karen spoke with getting providers into our area, not just under sole responsibility of the school. Because we can do what we can at the school level, but we also need to be able to follow through with the home level and have those people working in conjunction with the schools and the families to provide that care 24/7 so that our students don't regress. One of the other big concerning factors is me, as we are two schools that are in the SWIFT model, is the reimbursement model for special education, and how that impacts those SWIFT schools and how we can use the service providers, the special education teachers, the paraprofessionals, the occupational therapists, the speech and language therapists, the physical therapists, through that SWIFT model, through that reimbursement model that the state provides for the monies that come back to us. So that's been a thing that we've worked with Nicole Tusiani, Mr. Pembroke and I have worked closely trying to figure some of that out with some other directors of special education who are on the SWIFT model. And that's kind of where that is with me.
Rick, you had your hand up?
Yeah, I got a couple things just before Bill leaves. My first thing would be I would request, you know, that you guys confront and reject the message that continually comes from Montpelier that school systems' tax rates are too high. Specifically when it relates to the fact, and we've talked about it around the table, that largely Montpelier is driving our budgets more than we are. Our districts, our boards have done, in my opinion, phenomenal jobs keeping their costs down and their programs down, and we continually see pushback or push down from Montpelier. Additional cost, and then we get criticized by the governor and the leadership that the budgets are too high. So I request you to publicly do that whenever you hear that. I think it was Act 79, the teacher retirement fund. That's gonna cost us over $300,000 next year. To date, the boards have agreed to keep that in, you know, keep those programs. It's either gonna be a cut in programs or an increase in cost. Right now, the boards have agreed to take that cost shift on and keep those programs intact. But you need to understand that that is gonna be the major cost driver in probably all of our districts.
Teacher retirement?
Yeah, when our budgets hit the street. Another thing that I'm hearing a rumor that's gonna be on the floor, and I hope it's fairly early, is the dual enrollment, the funding of dual enrollment. As the law is currently written, Mount Anthony is required to pick up $30,000 next year. Rumor has it that there's gonna be a bill to have someone else fully fund it. I don't know who, but, if that is the case, I would strongly suggest you, support that and push that as quickly as possible so we could take it out of our budget, cause right now it's in our budget. You know, you talked about pre-K and small schools, just to piggyback on that. And as far as the refunding, I know that I'm probably an anomaly in the room, but it's the exception of maybe David, because I think David has seen the light. That Act 60 and 68, I think, works. I think it's a good formula. The key problem is, and I'm not saying it's you guys, but I'm gonna say you, the legislature, with the exception of maybe last year and maybe one other year, you've never let the formula work. You've constantly tweaked it. And the other problem is you have, I don't know how many exceptions in the excess spending formula. And it's gotten comical that AOE even speaks of those exceptions as, it's this town's exception, it's that town's exception, it's this town's exception. You gotta strip all those exceptions out of the formula. Let the formula work and let the process run. Now, the thing you have to realize is this is a state tax. This is not Bennington's tax, it's not Powell's tax, it's not Shasberry's tax. And I can prove to you, I have proved to many people in the past, even when we keep our budgets low, if not cut them, our taxes go up because we need to fund the program across the state. That message needs to get to Montpelier, and it needs to come out of there in a common sense way. It's not Bennington's problem, it's not Powell's problem, it's the state's problem. So I ask you to please consider those. The last thing, and Mary's been good about this, I've had some disagreements with some other lawmakers in the past. We do have resources that tell us what's kind of going on in Montpelier. It's not always timely. If something hits your desk, please call us. I mean, Mary has called me at least twice over my tenure here. Said, Rick, we got this bill on the floor, it's this. I said, I've never heard of it before. I'd go read it and I'd call her back and say, I got a problem here, I got a problem there. You know, you guys need to let us know what's hitting the floor up there. And I know sometimes things go fast and furious, but we don't have the resources to have someone sitting there just waiting for something to come up to say, oh, by the way, Rick, you know, we need you guys to help us in that. So please call us. Even if the trivialest of things, we will, you know, we'll let you know, no, that's not a problem, or yeah, well, let me look into that, or we have bigger concerns. But communication is a key from my perspective.
Who would you say is the, you know, a lot of people involved, who should we call? Any particular person who you would say, call anybody, call
I
you?
would call me, and then we
Call
would
your office, and
call
then
my
you would
office, and
distribute?
we would make sure that it gets to where it needs to go.
Yeah.
Because we're gonna, you know, we are gonna hear similar things usually from the Superintendent's Association, because they tend to keep an eye on it, and the School Board Association, which also emails the superintendent, so.
I'd also, you know, wanna call locally as well as superintendent.
But what may affect one area in the state may not affect, so there,
Right.
you can be getting kind of a summarization of a discussion that is looking like it's not going to impact you, but it may, based upon, you know, where they're from too. I mean, it is very different across the state.
If I could just, the Act for Autism, is 127. I should have asked you that.
Well, the other piece with, on the healthcare, we were trying to also do the mental health parity along in those discussions, which the budget on top of, which is law in the state, mental health parity. But even our committee was struggling with the huge cost of just the basic health care without doing the mental health parity, dental, and, you know, then all of the other pieces that people have wanted on. So those are also critical pieces as healthcare's going forward. Because those, again, I know that's more of your private insurance, and the Medicaid is critical in this discussion across the board for the population we serve, is that that's gotta be looked at very carefully too. And I'm not sure if we're going to have a representative on education this year.
Right.
So we're all going to have to do.
When will the committee assignments be completed? I know I read Saturday's paper that's still very much in flux.
Wednesday we should know.
Still up in the air.
And will that be published then by Wednesday too, that we would be able to get a list to see who's on those?
Probably should be on the website.
On their website.
It'll be in the journal,
Well, and then
Two.
the journal, but, you know, if
which
it's
comes
easy.
out very quickly after,
Mhm.
in a way.
Right,
It's-
yeah.
School Board Association typically
Yeah.
puts out their list pretty quickly.
There's one other thing that's been brought to me by people that I wanna see if you have views on, because it's been talked about, and that's the notion of the statewide teacher contract. Does this group have a position on that? Does it have an interest? What should we know about pros, cons, your point of view?
Well, not knowing a lot about it to make comments on it, but I'd be very skeptical of a statewide teacher contract. I mean, you know, I'll look right here in Bennington, we have two different school districts using the same contract, which has presented issues at times, so there are some very specific language items in individual contracts that I don't know how that would be addressed in a statewide contract. If it's a statewide contract to, you know, try and push a statewide salary schedule, I mean, there's regional differences there that, you know, I don't see how one size could fit all throughout the state, so without, I don't know if anyone else has an opinion on it, but that would just be mine.
I do, I think the state they all should go under the state. It just would take a lot of burden away from the school board members, I just feel that that's where it belongs.
So be employees of the state, or, I don't.
State should take the contracts over, it should be a statewide contract. The teachers.
Obviously, something like that would involve a lot of discussion, a lot of testimony, a lot of people that have to have positions. The things I've heard is that people look at that and you wonder what happens. If you had a median level now, would that median level be going up or be going down?
Right.
There's always you worry about the tendency with contracts about the rise to the top, not those that are at the top ever being willing to come down to a median. Now, that often is one of the big things I hear in these discussions, you know, when it goes forward. Whether that's true or
And
not,
how many steps
I
it
don't
takes
know.
to reach that
But
top
that's
too
an example of
varies.
one of the things that you would have to look about. I think the other one, you brought up another one. I think it's important to identify what the issues would be and see if there are reasonable solutions.
I think a discussion is valuable, especially, you know, with you know, what are the pros and cons to it? Maybe there is a great advantage to it that I don't personally see, but it's,
I think you know, probably the healthcare would have a bigger
Right.
pool for healthcare, and where that would fit up would be an example. I just don't know enough about it, but I've heard it enough mentioned to me that I think it's important that you aren't, that you tell me what you think. I'm not hearing it from legislators. I'm hearing it from constituents, I'm hearing it just in general conversations. So I just think it's worth, this is a meeting at the early of the years to look at all the trails that
and
people
close
might
to
go
you,
down.
and you mentioned Woodford earlier. Now, Woodford doesn't even operate under the teacher
I
contract,
know.
so where would that fit into?
Exactly, but, so there are all those things that have to be figured out. I think what I would take away from that is that, you know, from Cindy, is that there could be something valuable there, considering how small a state we are. And you even look at the consolidation piece, where you have a population of 620,000, and people say to me all the time, I grew up in a place where that was the size of my local school district. You know, it's just one district, you know, but we don't operate, that's not our business plan here,
Yeah.
that's a big urban model, you know, for one. So that would be part of it.
I tend to agree with Cindy. I think, and disagree with you, Jim, only because I think there's many issues in the teacher's contract that could be broken open and could be addressed from a fresh point of view. And I think that now's the time to do that. I'd like to see an organization or a committee or something initiate that with input from the state, from our various board members around the state, and see what they could come up with, the pros and cons of having a consolidated contract. I believe things such as professional development, sick days, all kinds of other perks that are in the contract, we get an uneven playing field. We start all over, and it's worked in other states. The state of Hawaii has done it, and it's working there. And that's the other thing. We should look at other examples where it is working.
Best practices wherever you can find them.
Right.
Yeah. But best practices for similarly situated constituencies, you know, so.
Yes.
Fran?
Well, that all sounds good, and yeah, it'd be nice to explore. How long have we been talking about consolidation? 10, 15 years? Hell, we won't live long enough to see the statewide teacher's contract. But anyway, I think it's worth looking at as long. I wanted to speak before attending a recent VSBA meeting in Manchester, and we had talked in a group about consolidation. Some of the members said, hell, unless we're forced to, we're not going to do it. So, I mean, you've got that sentiment out there. It'd probably be the same towards the teacher's contract. I don't know that, but I would like to see that study. But you can't take 10, 15 years to do it either. If you're going to do it, you take a year or two and you decide whether you're going to do it or not. You bring it to a, I don't know how you don't bring it to a vote, but it takes too long to do studies, way too long.
Well, on the along that line is that we do know that I think about 5 or 4, I don't know how many school districts recently did come together in the Underhill, Jericho, Richmond area. I think it's probably really important is to look at that and see what did they get, what did they lose.
Right.
You know,
Yeah.
so you can be objective about it.
Yep, absolutely. I mean, I'd like I said, I'd like to see it, but I don't have much faith in the system as far as getting everybody to agree and everything, because it never works. But that's just my opinion.
Yeah, well, you can't do it, as you well know, without at least getting people's opinions.
I know, you're right.
You just can't, or it's.
Yeah, just in the discussion that
There's
I have
teachers,
heard
too.
from the different boards that I've been attending, there's not even agreement on individual boards. You know, the Shasbury board, there's a disagreement right there. I don't know what the vote would be on the Shasbury board on consolidation, or there are difference of opinions right on those boards, never mind within the supervisory union. But I don't know, that's maybe the beauty of it too. And so I'm mindful of the time, so I'm going to begin to wrap up unless there's, so this will be the last round if somebody has something. Dave, is that hand up?
Yeah.
All right. Yeah.
Just to follow up on the contract question. The boards spend a certain amount of time negotiating contracts, that's for sure. Obviously, the association puts in time and resources as well, and there's a cost to doing it. So I guess I would start by asking you why, what are we trying to accomplish by moving to a statewide contract? It's hard to imagine there's so many, as you said, Jim, and so many specifics that we've negotiated into the contract. Maybe it would be good to re-examine all of that. I mean, I suppose that could be the answer to the why as well. But it seems to me the salary and insurance are going to be basically, at the end of the day, those would be the key things. And you could negotiate that and leave everything else to the individual districts, then we'd still be spending the time and the resources. But just, I would start by saying, let's look at the cost of living in Burlington, in Essex, and compare it with, this part of the state.
Southern Vermont,
Yeah, and if you end up with a statewide salary, it's gonna have a different impact here than it would up there.
You'd have to have an adjustment.
Yeah, so then at that point, why not just do it?
Why not just
town by
break it
town?
up and do it locally?
The way we can do it. So, yeah, I mean, I think it's worth looking at because there is a lot of work and a lot of heartache, especially when you have a situation like we had a couple years ago.
Well, for me, I appreciate it. It's not like I have a position on one or the other. I think that it is from these kinds of discussions that you start to lay out a landscape and decide whether or how you either would or could or not, because obviously there's disagreement at this point. People are going in with hesitancy, people are going in with worth looking at it and all that. But if we don't bring it up, I wouldn't even know that. And Kaya and Mary wouldn't know it, so at least we know that it's not resolved at this level. It's not like everybody's saying that you should or should not do this. That's a temperature reading that's very helpful. And I hope we do more of that with the issues that are out there.
How loud are you hearing that discussion for a statewide contract? Is there a lot of legs to this? There's a lot of movement on this?
Where would I put it? I don't know what the temperature. I would put it in the 40%. If you put it on a temperature range,
I was gonna say low, I would say low on the.
it's relatively low, but it comes up at a lot.
Yeah, it does.
Yeah.
No, it's been on the School Board Association's website.
So,
They've been
so,
talking about
and
it.
just so that I understand it a little bit better, so where's the Vermont NEA on this versus the software section? I don't know.
Well, I think you just answered your
They went
question.
up to it? I guess in my mind, I could envision where they would have been pushing for that because it could in theory raise salaries in lower districts. So.
Well, yes and no. I don't know, to be honest. I could only speculate from a point of view. Are you better off of, using examples from for whatever their goals are? I would want to know what their views are. I'm certainly not hearing anybody. Well, I hardly ever hear from the VSCA actually directly. That their leaders call me up and say, "Hey, Bill." But I do know our local teachers.
Yeah.
And I do know that without good local teachers, nothing's gonna happen.
All right, anyone else would like, because then the last thing we're gonna do is we're gonna set a date for our next breakfast, and we're gonna need particular impact from our legislators, because you guys are gonna disappear for a while. But is there anyone else who has a comment or question, or something that you would like our legislators to take with them as they depart on Wednesday to Montpelier, or maybe you're going up on Tuesday?
The only thing I would like is the open communication, so if you're hearing something that we, being in our specific committees, are maybe hearing later, if you also reach out to us if you want, obviously further discussion and input or alert that you're concerned about something. So it's gotta be,
And we don't wait till we have another meeting.
Right, cause that's
Good point.
critical.
How about second Monday in February?
So that would be the 9th, so we're looking at?
I guess so. I know I have first and third early morning commitments,
Mhm.
so I just
Is there anyone that February 9th would not work for?
could start there.
At this point, it seems okay.
All right. And I know,
That can
I
change very
can see that it's not gonna snow that day too, All right, well, thank you all for coming. Did you got it?
Last month, we attended a meeting with the Bennington Selectmen, and unfortunately, the town manager isn't here. I was in hopes he was gonna be here.
I know
Would
what
you
you're
feel
gonna ask.
comfortable reiterating about the homestead tax reimbursement?
Well, I don't know if I feel
discussion?
comfortable with it, and maybe Rick might have to jump in too here, but the town manager did make the point that the volume of rebate checks that they are writing, again, it's because of the income sensitivity, and so what people are actually paying in taxes, and it's just is I would guess in his opinion, I don't wanna speak for him, they're writing more rebate checks than they ever have before, which effectively lowers people's tax rates, and is that fair to, cause and cite an example of how, like, somebody who bought their house, and on the spec sheet of the house they're buying, there's what the tax rate was, how much taxes that house was paid, and then their tax bill comes and it's significantly higher because they didn't qualify for the income sensitivity, so.
I would think it would be the other way around, but.
Yeah,
I mean, I think you would
Any
put out,
credi-
here's
any
the value
credible
of the
realtor
property.
ought to put the real tax rate on the.
They should.
Yeah, they should.
That's right.
Info sheet,
Yeah.
but, I mean, I think the problem is I wasn't at the meeting, so,
Yeah.
but I can reiterate what everyone talks about is the level of the income sensitivity, which I think is now up to like $92,000.
Yeah, it is up to 90 something.
And, does it make sense for someone making $90,000 to be getting a break on their property taxes, school taxes? Originally, I think it was originally set at 42 or something when it was.
Remember, it's household income.
Well,
Profitable 245s or even, a couple of 330s or it's.
Right.
I think we're pointing out it's a odd, rough measure.
It's,
Well, one of the
yeah,
problems.
part of the big problem is in this community, when I say this community, I'm talking the SVSU as a whole. And this is just gonna speak to one of the underlying problems to the community in and of itself is, I think we're over 70% of people that get income sensitivity payments. And, that is, a situation that is not necessarily the school system's making.
I think that is the best exit line for me, because the workforce education development is the place where incomes grow, and because Vermont has an income issue out there of, the fact of how income is out there distributed, the amounts of it, has an awful lot to do with these discussions.
It's more than how the income grows, it's the quantity of the incomes that we have. We
Well-
have enough people working.
And it's also having the jobs to place them.
Exactly, all of that, but,
Not enough people working at a
Yeah.
living wage.
Employers are looking for workers, people are looking for jobs. That's another real big problem, is that really at the heart of everything we're talking about here in the education
And
of
that
making
does-
sure there
that
is
does
a
affect
stellar
the
workforce.
The educators in the room can say that does affect our classrooms too.
Yes.
These kids that are coming in under poverty. are
And I don't
Absolutely.
really, I'm not that familiar with it, but I also think that, how that income is earned too, is not affected on whether it's earned income or unearned income. It's the same rate, and I don't know, Jim, am I right on that, was the
Well, I
point
think
there?
that was the point that was also made, is that a good accountant can also hide that income, or readjust it, so that there's a lot of payments that are going out, they're increasing more and more, that's the thing. And some may not even be qualifying for it.
Right, as the system ages, that more people have learned how to game it.
Yeah.
Would be the comment. Whether that is an accurate statement, I have no idea, but it's probably worth looking at.
Yeah.
Thank you.
All right, so, thank you for coming, and we will see you
Thank
all
you.
February 9th.
I know